Welcome, warm by all means, as here in Venice, it's like we are having like experiencing a heat wave. A warm welcome to all the many participants that we have. I can see that we have many participants from many regions and countries connected. Welcome to the second webinar organized by the Regions for Health Network in collaboration with the WHO European Centre for Environment and Health and the WHO Regional Office for Europe. My name is Francesco ZAMBON and I'm the coordinator of the Regions for Health Network, which is organizing these webinars. I can see that there is a lot of interest for this topic, and I'm sure that there will be even more interest after this webinar. We are lucky enough to have two very important speakers, very important for this tool. We have Francesca Racioppi, who is actually the mother, if we can say so, of the HEAT tool. And I would like to take the opportunity to congratulate with Francesca, as she just received a non-honorary doctorate in Stockholm for developing precisely this tool and for her contribution to the field of environment and health. So Francesca, thanks so much for your time and for being with us today. And then we have Nick Cavill, who is the director of Cavill Associates, Research Associate of the University of Oxford, and Honorary Senior Research Fellow at the University of Salford, who is also he's an expert in this tool. Today, we don't expect that at the end of these webinars you will be proficient with using the tool, I guess. But what we want to do is to raise awareness on the existence of this tool and what its uses can be. And of course, we are available for further assisting you for any kind of information that you might want to pose to us. Some housekeeping information before I leave the floor to Francesca. The duration of this webinar will be 60 minutes. It will be recorded and then it will be uploaded on the RHN YouTube channel, where you can also find the previous webinar. You have been muted in order to reduce the background noise. And if you see that you are not muted, please mute yourself. The chat is open and is open to everyone, so whatever you write in the chat will be seen by all the participants in these webinars. I can see that we have more than 40 connections already. And please use the chat to channel any question that you might have, as there are many participants. I have here with me Brigida, and together we will look into the chat, and if you have any question, please don't hesitate to write it down on the chat, and then we will raise it to Nick at the end of this webinar. Francesca, I think that I might leave the floor to you, thanking you really warmly once again for being with us today and for giving an introduction, and there's no better person who can do that better than you. Thank you very much once more.
Thank you, Francesco, and good morning, everybody. Thanks a lot for joining us today for this webinar from all over Europe, I understand. And thanks to Nick for agreeing to be our principal trainer today. Francesco, thanks for your kind words of introduction, but you know, a tool like the HEAT is something that has been developed over, I would say, more than 10 years. And the family of parents, uncles, and cousins is a very extended one. So Nick is, in fact, you know, there is a core group of 4 people who historically are behind this tool. And Nick is certainly, together with the Professor Harry Rutter and Dr. Sonia Kalmayer, is a part of what we very modestly used to refer the Fab Four. But this is to give you an idea that the health economic assessment tool has been a major undertaking for the WHO and our partners, and we are happy to bring it to you today. We are very excited because this is the first time that we are holding a webinar specifically dedicated to policymakers at the subnational level, at the regional level, local level, but we know that there has been a lot of interest also from national focal points on environment and health to follow this. So we are very happy, Francesco, of the opportunity that this Regions for Health series of webinars has given to us to bring the tool to the audience for which it was initially intended. The reason why we developed the HEAT was to help people who are in the policy-making field and are not necessarily in the health field. They are at the city level, they are in regional governments, they are dealing with urban developments, transport planning, with the tool that would help them to see cycling and walking. Because from a health point of view, of course, the World Health Organization is interested in promoting health, and we know that cycling and walking is one of the best buys and delivers multiple health benefits through physical activity, but also through improvements to the environment. What is special today is that for the first time we are presenting to you the newest version of the HEAT, the Health Economic Assessment Tool, which was released in October last year thanks to an EU-funded project, which is called PASTA. And for the first time, we are able to offer to you a tool that answers a very important policymaker's question. And the question normally is, yes, we know that promoting cycling and walk is important, but what about air pollution and what about crashes? And is this going to be good for our greenhouse gas emissions? And with the WHO having released not later than last week new important data about the effect of air pollution on health, we feel that the new developments of the tool are of interest to our intended audience. So I'm very pleased that today we have an opportunity to demonstrate to you the tool in its new version. And I'm very excited of having so many people who have responded to the invitation to participate in this, and hope that there will be follow-up. We are having a project of testing the tool with a broad basis of users, so we will also be happy to take up your interest in joining this group of users that we will contact in the weeks and months to come to improve the tool further. And without any further ado, I would like now to pass and to give the floor to Nick, who will take you through this little adventure through the HEAT tool. And thanks again, Francesco and the Regions for Health Network for this opportunity, and Nick for joining us today. And welcome everybody. I hope you will enjoy.
Thank you, Francesca. It's Nick here, and I hope everyone can hear me and now see my screen. Please shout if not. So I'm going to show some slides to introduce a little more detail, the background to the HEAT. I'm going to show some applications of places where it's being used, and then I'm going to switch across and in the hope that the internet keeps going well, we'll do a live walkthrough demonstration of the actual tool online. But first of all, really just to expand a little on what Francesca has said. She talked to the family of the HEAT, and here's the enormous list of people so far who have been involved in the HEAT production in one way or another. And this list gets longer and longer as we introduce more expertise, for example, recently drawing on the experts from air pollution and environmental science. And we want to, and again, as Francesca has said, we wanted the HEAT to influence policy around walking and cycling through making the case from an economic point of view to help both really people locally, so people in planning, for example, in transport and urban planning at the local level, through to European level policymakers. to expand on the well understood notion that cycling and walking are healthy, and to demonstrate that they're also healthy for the economy and the environment. And really we established some core principles which are very much part of the way the World Health Organization works, which is about building on a scientific, robust evidence base. But also, and this has been the challenge all the time in developing the heat, if I'm honest, the balance between scientific robustness and usability. Our challenge was, how can we make something that requires minimal data from the user, that uses default values and workings behind the scenes in order to make the user's journey as easy as possible, and how we can make the tool itself clear to use with prompts and so on. We also were very focused on the tool being transparent and all the assumptions and the approach being transparent. And as a result, we have a very long and detailed user manual that contains all the scientific information that's needed. We are making the case for walking and cycling, but we want to make it on from the standpoint of a strong evidence base. And so the tool is relatively conservative. So when there's a range of values that might, where the highest value may make the case more strongly for the heat, for walking and cycling, we generally choose the lower value. So we aren't campaigners, we're scientific policymakers trying to make a strong and conservative case for cycling and walking. And as we will demonstrate in that we have just added new modules to the heat on air quality and crashes, we wanted the model to be adaptable and modular, so it could be built with new modules as it goes along. So what is it? It's at this address, heatwalkingcycling.org. It's also accessible via the WHO Europe website. And as we've said, at the core of this is to help transport planners and others make an assessment of the health benefits of walking or cycling from an economic point of view. And what we've done then for this, for the first 10 years really, is focus on mortality. So we know this, and this is an important distinction, and many listeners will be interested in this aspect, I'm sure. We know that physical activity and walking and cycling are good for a range of morbidities or illnesses. We know, for example, that walking and cycling is good for mental health and well-being. But those aspects are very hard to demonstrate in a quantified way with strong evidence that would underlie such an evidence-based tool. But on the other side of this argument, we know that physical activity and walking and cycling have very strong relations with reducing mortality, and clearly that's the most important measure of health. So this module of the heat looks at the effect of walking and cycling on premature mortality. So it compares, well, I'll explain in a moment how it does that. So it's interesting to think that from this point of view, the assumptions coming from the heat will be conservative because we can add on all the other aspects of health that we know are improved through walking and cycling. So how does it do it? Well, the core of the heat answers this question. If X people walk or cycle a certain amount on most days, what's the economic value of the health benefits that occur as a result of the reduction in mortality due to their physical activity? So you need a volume of people walking or cycling an amount of volume, a number of days and the right distance or time. And heat says, well, that physically active walking cycling population, how does their mortality rate compare to a sedentary or inactive population? And that's the basic way that the heat works. It relates the mortality rate with active versus inactive population. And the new heat, launched last year, addresses really the potential criticism. People may say, oh, good to get people walking and cycling, but they're now exposed to additional risk due to their walking or cycling in polluted air, or their risk of being knocked off their bicycle or killed through a crash. So we the new heat option says how much does the health benefits of cycling, how much are they reduced by air pollution or crashes? And also an additional question, what's the impact of these changes, these shifts to walking and cycling on carbon emissions? So we're really trying to build on the heat and keep it up to date and also address potential criticisms. It's been going for 10 years. We've had a lot of interest, 40,000 visits to the website and so on, and across a very wide range of countries, including USA and Australia and New Zealand have all shown interest in using and adapting the heat. And that's the little shot from the website, but we'll go to the website in a moment live and look through it. So now I'll just take you through a few examples. So maybe if people on the webinar aren't quite so interested in the technical detail, then I hope you'll be interested in the way that it's being used in some countries. So for instance, in Estonia, the Estonian government were looking at new cycle routes, and they wanted to say what would happen if. So this was a hypothetical modelling scenario, and they said, when we build our new cycling routes, if we have let's assume that we will achieve 230 cyclists per day, 50% of whom were new to cycling along this route, and they did a heat calculation to produce this average annual benefit, and told us that this economic assessment helped to get the funding to build a new bike path and to feed into broader assessments. So this was about looking to the future and saying, we think investing in cycling will be worth it in this town, and here's why. In Glasgow, in the UK, a health-focused organisation wanted to look at the existing level of cycling. So this was real data, and they said, let's look at how much cycling happens already in our city and what it's worth. This was a particularly, lots of heat calculations are scenarios and using made up or hypothetical data. This one wasn't, it was very strong, and they used data from the census. And they said that in Glasgow, cycling was worth 3.5 to 4.5 million euros per year. And this was really used in general to make the case for cycling, to say, keep investing in cycling, look how much it's giving us. In Boston, in the USA, very early days of the heat, they used the heat back to front. This was quite a weird one. So the Boston Council were looking into a proposal to increase fares on public transport. And someone who thought this through well said, well, if we have increased fares, we'll have fewer people on the buses. And as we know that bus journeys always begin and end with a walk, let's look at how an increased fare structure would lead to decreased walking. So the heat can be used backwards to value a decrease in walking, if you want to do it that way. And they produced this analysis that said these proposals would lead to a value of reduced physical activity of 57 to 89 million euros per year. Now, unfortunately, I've got to tell you that the fare proposal still went through, but the Boston Council still felt that this analysis was useful and a good addition to the policy arguments. In Modena, a similar approach to the Parnu one. We have a new path planned. Let's look at if our thousands new cyclists use the path, what does it give us? And they produced annual benefits of over 400,000 euros, and like Parnu, helped to secure funding for the path. And in Spain, this was one of we have lots of examples of the heat for cycling and few for walking. So if you are going to use it, please let us know, particularly if it's walking. In Palma in Spain, they used a mobility survey to look at the potential economic benefits of increases in walking, and found annual benefits of 32 million euros, so significantly high figures, and these fed into policy discussions. Just two more to go. In Kuopio in Finland, they were particularly interested in improving conditions for cycling to work among employees from the city council. And they used an online survey to ask people how often they cycled to work, and calculated the average annual benefit. Very broad range here, from 400 million euros. I don't know why the big range, but I think they had lots of different assumptions. And here the results were used in particular for promoting cycling during the winter, when cycling levels were seen to drop off. And the final example is one that I worked on in the UK, in England actually. This was just in England, where the Cycling Demonstration Town project promoted cycling across a number of towns in the UK. And here you can see how the heat was fed into a broader, more comprehensive cost-benefit analysis. So the top figure, reduced mortality, is the heat figure. So the increases in cycling that were measured from this project led to reduced mortality of £45 million, so that's about 55 million euros per year. But look underneath, other tools and other approaches were used to say, but also decongestion leads to benefit of 7 million, absenteeism 1 to 3 million, and so on. And so you can see how the heat, the mortality aspects, can be fed into a broader assessment. And in this example, you can see the mortality benefits account for the largest proportion of the benefits, or the risks of increasing cycling and walking, in this case over 70%. So we've had so far multiple applications. This slideshow could go on for another 30 slides, and you'll see, if you're interested in applications, there is a set of them on the WHO website. And we've had good feedback about its use. People feel that it's having an impact and influence on the policy debate. We are always challenged to find strong evidence for a direct link between the use of a heat assessment and some sort of policy change. So again, if you use it and feel that it's helping the policy debate, please let us know. Einstein once said, "I thought of that while riding my bicycle." So, shall I pause now, or shall I just go through the application of the heat and then take all the questions at the end?
Nick, thank you very much for this first part. I think it was extremely useful and interesting, and I think that the interest now is even bigger than before, because we have seen how it can be practically used, and I also understand the issue about the balance between scientific robustness and the usability of that. So now we really want to know how it actually works, and what kind of variables and information and indicators are you using for computing these very concrete outputs, which are so useful for policy making and also policy analysis. So I think that if you can give us a live demonstration, that would be appreciated by all, and then we will open the floor for discussion. Thank you very much.
Okay, so this is live, then this is online, so I've just gone to heatwalkingcycling.org, and there's an introductory page. Of interest here, I think, is this aspect. Well, so let's orient ourselves first. As usual with the website, on the left we have the main navigation buttons, but also of interest over here, on the right we get sort of hints and tips and information that we can click on to help the user go through. But just to highlight how the heat might be used, I think I've shown some examples using the slides, but you can see here that the heat can be used to assess past levels of cycling or walking, to assess changes over time, or comparisons. So this might be before and after, or comparing one place with another place, or to evaluate new or existing projects. So really the thing to remember is that it puts a value on a volume of cycling or walking in a population. And so you can use your creative thinking to think, how would I use this? Would it be the value of an increase, or as the Americans did, the value of a decrease, or the value of existing cycling, or whatever? So if you start here, you click on this, start using the tool. Now this big heavy page, but I would just like to highlight some of these caveats. The first here is that heat is a population level tool. This is not to be used for individuals who have changed their exercise habits. It's not to be used for really small groups of people. It's applying averages and means across a population. So we have to bear that in mind. It can't be used, or it should not be used for unusual behaviours. So if there's a one-off event or something where very unusual levels of physical activity are occurring, that's unlikely to reflect habitual, regular behaviour. So the heat's inappropriate there. The heat is designed for adults only. We would love to have a children's heat, but we don't think the evidence and data are available to do that at the moment. Really related to what I said just now, the heat is an average tool for population level, so it shouldn't be used for triathletes or Ironman or Ironwomen triathletes, or maybe even bicycle couriers or mail deliverers who walk or cycle all day. It's to be applied to a population. The air pollution model, you will see there's some background data in the tool, but it's not designed to be used for environments with extremely high levels of air pollution. And really the overall thing to realise is that this is a model or tool using averages and using best data available, but still we are in an environment of uncertainty, and we have to understand that these are only estimates that we produce from this tool. Okay, so with that over, let's click on Start a Heat Assessment. And this opens up a new little page. And when you actually run through the tool, you will see that the data, the information given to you, we've tried to keep as short as possible. So that's just an introduction. So I'm going to do just a simple hypothetical scenario. What if across our city, where are we? Venice, 1,000 more people walked for 30 minutes every day. So a new campaign or program or something reaches 1,000 people, and every one of those 1,000 walks for 30 minutes every day. Not too, I think that's quite ambitious, but not too mad. So let's do that. So in this example, we will just tick walking and go forward. Are we assessing? So the next question is whether you're assessing your impacts at these three levels. In our case, we're going to be city level, and we're in Italy. Let's see, I didn't check this before. I'm sure we've got Venice on here. That's Venice, isn't it? Venezia. Now, this is a little bit complicated to understand, but it's not too bad. So the heat, as I said before, can compare two scenarios. Usually, we're thinking about before and after, two time scenarios. But you could compare two different places. You could compare a intervention case with a reference or comparison case, and so on. But we're just going to keep this button clicked single case, because we're just saying, in Venice, what's this volume of cycling or walking worth? Next question on this page is over how many years benefits should be calculated. And this really is up to you, the user, and the sort of standards that you want to apply. Most economic assessments tend to do 10-year comparisons. but this can be changed if you want to here. So we'll leave that as 10 years and click next. Which impacts would you like to consider? This affects the sort of pathway that the tool takes in terms of whether it's about physical activity, air pollution or carbon. Let's keep it simple for now and just do a physical activity assessment to keep it as straightforward as possible. And the next section, so this is just about where we input the data. And this is as complicated as it gets. We are just asked for how much walking, so is that in minutes, hours, kilometers, and so on, all these options here. And this is designed to make it as flexible as possible according to the data you have. So we're going to leave it as minutes, because if you remember our question was 1,000 people, 30 minutes. So 30 minutes there, and that's it. This option here is usable when you have different types of data to input into the tool. So in this example, we're looking at 30 minutes per person. If you're looking, for instance, at route user counts, you may want to click data that's available from the individual pedestrian. So we'll leave that there. We then are interested in thinking through the population that we're applying the heat to. So this is the second thing we have to input. And here you can vary the risk slightly by choosing younger or older or average population. We'll leave that as average. And this is where we're entering the number of people that we're studying. And I said that was 1,000. So don't forget, all we've had to put in so far is 1,000 people walking for 30 minutes per day. This is a sort of advanced feature. We don't need to worry about this. But if in some scenarios you wanted to vary the level of risk or the level of exposure, then you could use this slider. But for a basic assessment, we just flip past that. Introduction. And here we are, it's calculating away. Now this next page looks slightly scary, but it's actually really just a review page. And what the clever programmers have done is highlight these green sections are editable. So we could, at this stage, think, oh, actually, we want to have an 8-year assessment instead of the 10. So you can change. So, but basically, this is showing us the data that we have put in and what's going to be used for the calculation. So we've told it that we are starting in 2018, and with a 10-year assessment, we'll be comparing to 2028. It's given us an average walking speed, so if we thought our population was faster or slower, we could change that. It's given us the discount rate for the economic calculation. This figure is extremely important, and this is the value of statistical life because we inputted Italy, and so it's found that from the database. And also, it's given us automatically the all-cause mortality rate for Italy to make the assessments. So we just click results. And this is it. This is the results page. So this was all we had to put in, if you remember, 30 minutes per person per day, 1,000 people walking 30 minutes per person per day in Venice. And this has told us that that level of physical activity, so just 1,000 people walking half an hour a day, leads to 0.4 premature deaths averted per year. So obviously, over 10 years, that's 4 deaths prevented. And then in terms of the economic assessment, all the heat does is use this value of a statistical line and multiply it by the number of deaths that have been averted due to increased physical activity. So it's telling us that our campaign, or whatever it was, that got 1,000 people walking for 30 minutes per day, has provided an economic value of 1.2 million euros per year. And so over 10 years, 12.3 million euros. And then finally, the heat looks ahead and says, well, in 2028, that value will be, the economic value of this savings will be less in 2018 due to inflation, and so it discounts the value back to the present day. So this is the figure that should be quoted in most assessments, 9.8 million euros over the full 10 years as a result of these people increasing their walking. So I'll pause there, and that was a relatively simple hypothetical example of just physical activity, and see if people have any questions.
Thank you very much, Nick. It's really fascinating, and it seems also it is quite simple to use, and I immediately want to start a campaign for walking more in Venice, but I want to get at least 10,000 people so that we can avoid at least 4 deaths per year. But already the figure that you get from the economic benefit are quite impressive, even just mobilizing for 30 minutes 1,000 people more. And I would like to ask the participants to write their questions through the chat, and we hope that you have questions. I would like to start with one about the value of statistical life. You mentioned that for Italy. So does it mean that you have a value of statistical life for each of the countries that were listed at the beginning of the list, like for all member states? Because I know this is quite a sensitive figure to calculate, and I mean, there is also a debate around the use of such a figure for, I mean, in terms of economic values. So can you tell us more about that, and also about the availability and what the system does when this value is not available for a specific country? And please, participants, think of questions.
Yes, so value of a statistical life is very commonly used by transport economists, and others too, but really because we designed the model for transport professionals, we wanted to use their language, if you like. And you're right, it is debated, because essentially the value is placed on one life, and some people find that a difficult or an uncomfortable concept. But I think it's important to realize where this comes from, and actually the light bulb moment that Harry Rutter had in helping to design this tool, because he said, well, if transport economists use this figure to say our road safety improvements, so our new traffic lights, say, will save one life because they will make the roads safer, how much is that worth to our transport system? And so the transport planners use this concept of a value of a statistical life to feed into the economic models. And so Harry said, well, if we can look at that in a negative way, then if we save lives through increased walking and cycling, we can use the same argument. And you know, there have been debates in the last 10 years of running the heat, but no one has told us with any confidence why we can't use this approach, why it isn't appropriate, because it's about saying, in this example, 4 lives have been saved through increased walking and cycling, and that has a value to society. To answer your more detailed question, yes, each of the countries listed on the drop-down menu, so that's all the member states, has a value, and if something changes, or if you have an updated value, that can be changed in the page that I showed you where there were editable values. You can simply enter your own value. So, for example, in the UK, the figure that most transport economists use is quite a bit lower than the OECD figures on which the heat is based. And so UK transport economists just enter their own figure to make an assessment that links and is approved by the the Department for Transport in the UK. So it is changeable, and of course this can be updated as things change in the future.
Thank you, Nick. We have one question about the tool, whether it is the same for walking and cycling. I guess that this is something that if we go back to one of the first phases of the demonstration, right, where you can choose whether you are estimating the benefits of walking or cycling. But is it the same tool used for both?
Yes. The inputs are slightly different. So, for instance, with walking, we can have steps. With cycling, we don't. But essentially, it's the same. The underlying values for risk are slightly different, and in both cases, they're taken from a meta-analysis of the academic literature to find the best figure that represents the risk reduction of cyclists and walkers.
Questions are coming in. Nick, can you see the question yourself, or should I read it? Like there is one question, I can read it aloud. Why using value of statistical life and not volley approach, value of life here? Because when air pollution, traffic accidents are taken into account, the age of death is mostly younger for people dying in traffic than for air pollution, where the elderly are more vulnerable. Is it not more correct to use the volley approach in that case?
So I think if Francesca is still around, she may wish to add to this, but I think, Jürgen, you have a very good point, and something that we've grappled with on the core group. And really what this comes down to is the tension that I talked about at the beginning in terms of trying to make this tool as usable and as universal as possible. So for relatively advanced modelling of the impact of physical activity on air pollution and traffic casualties, involving where we have data on the age ranges of people involved, then life year approach using life tables probably would produce more precise results. But we felt that the additional complexity was not going to be useful for our users in terms of producing usable values that provide good estimates on which to make the case for walking and cycling. So technically you're right, but for the purposes of the heat, we felt this was more appropriate.
Thank you, Nick. I know this is a very tricky point. Francesca, are you still online? Do you want to add anything on this? Otherwise, we go to the next question, which is how large should the population be for your output to be reliable?
Yes, that's a good question. There's no clear answer, apart from the larger the better. So we said at the beginning we can't use the heat for small populations or families or an exercise class, for instance, that it should be used at population level. In short, the larger the population on which the assessments are based, the more confidence we have in the results. And so we tend to see things more on the level of a community or a town or a city rather than a small group.
And Nick, maybe you already said that at the beginning about the morbidity components, which is not included in this tool. Yeah. But one question was, what about adding into on general results about cost of morbidity to say this heat tool is part of costs saved to help convince policy people?
Yes, that is interesting.
And related to that, if I can also add this part of a question, we didn't see the component about air pollution and crashes, right? You said that this is a new module which is being developed, correct? Yeah. Because I guess that the component of air pollution and crashes would also have an impact in terms of economic assessment. So
well,
how
shall I go
that
through
is
that?
factored in.
And I notice other people have said, how about a cycling example? So shall I quickly go through a cycling example using air quality?
Yes, please. That would be good. And while we are doing that, if we can also keep in mind the other question, which can be answered in the meantime, about cities and how
Yeah.
these are selected. For Belgium, you have a few cities in the tool. Are they representative for the
Yeah.
other cities in the countries as well? And how these cities were represented, and what to do in case the cities is not there?
Yes, I think the key is in this sentence here. If your city is not listed, choose a similar city. Now that I think that's
Okay,
just,
that's fair enough.
yeah, and I think that's just we couldn't list everyone. But as I understand it, the city level is for air quality assessments. So that's the basis on which you should choose a similar city.
Yeah, if I may, this is Francesca. Sorry, before I.
Yes, please, Francesca. More welcome.
What is the introduction of cities is one of the new features that we have introduced when we have introduced the air pollution module. And the cities that you see there are the cities of the WHO air quality database. And actually, because the WHO released just last week the new global database with the data on air quality at the city level, we are going to refresh this data. So the cities that you see there are the cities of the WHO air quality database for which we collect the data. And if your city is not there, it means that it is not perhaps yet included in that database, and therefore we advise you to look at cities where air pollution is kind of comparable to the one experienced in your city or town. Yeah. So this also gives you a little bit of background on the default values that the tool provides, where we are taking them from. And the same for the mortality data, they are coming from the WHO mortality database.
Okay, thank you, Francesca. So what I've done, I think there is time to do this, what's left. I've just quickly nipped through a cycling assessment, and I chose physical activity, air quality, I chose all the options. So everything was the same until we get to this lovely page. And this is to help us assess the likely impacts on air quality and carbon. So this is about, so at this point we have to choose or estimate a few things. The first is what proportion of the new cycling, so I've put in 1,000 people cycling for 30 minutes a day, what proportion is for transport? Is it all transport cycling compared to recreation, or is it all recreation? The default ends up at 50, and this is important for air quality, because people who are doing recreational cycling will be choosing usually country lanes and parks and so on. In terms of the carbon emissions, this is important. What proportion of the new cyclists do we think will have shifted from walking? Have we got all people who were previously walkers are now cyclists, or not? So these are currently set at the default values that the heat tool estimates. Important, of course, is the proportion shifted from driving. That makes a difference to carbon emissions, and the proportion shifted from public transport. So you can leave these at the defaults, or ideally use your data to input into this. Now this is, as people might understand who are used to cycling in traffic, this is an estimate of the proportion of the new cycling that takes place in traffic away from major roads. Is it half in traffic, or is it all? You just move the slide up. And then an additional set of questions just to try to refine the air quality estimates a little further, whether we're talking about the sort of average figures, or if we really are concerned about some of the congested traffic. So do you remember this table? This has now got a little bit more complicated. So we've added in so we got down to here before, so now you see the assumptions being put in for PM 2.5 particulate concentrations in Venice in this case, fatality rates for Italy in this case, only available at country level, and then additional figures for distance of bicycle trips and figures about the value of carbon being used in the calculations. I don't know why there are two entries there. They're the same anyway, just repeated. So again, these green boxes are editable. So if you were doing a study where you had a measured PM 2.5 concentration, for instance, you can edit it here. So,
thank you very much, Nick.
So here's quickly on the results page then. We can see that the cycling, 1,000 people cycling 30 minutes, has led to 0.3 premature deaths prevented, and you can see the improvements in terms of carbon emissions. So it does lead to a more refined calculation. I'll stop there.
Thank you, Nick. I can also see that in this last demonstration, there are some assumptions that also the user, the one who is using the tool, has to make sometimes, because maybe, for instance, for the proportion which are shifting from driving to cycling, might be difficult to get in absence of data, but I'm sure that the users know where to retrieve the information in their country if this information is available.
Yeah, that can be tricky.
Sorry?
That can be tricky, but the heat assumptions built into the model are based on the best available data, so the user can always just choose the default values.
Sure. Thank you. We have some other questions. What figures or time period of data are enough to have a good estimation or a good prediction in our country? Or is there like a preferred time span that you would suggest, given your experience and knowing the modeling behind that?
Well, I guess we're looking at two time periods here. One is the time period for the actual impact, and two, the time period for the assessment. So, for instance, if we ran a campaign this summer to get 1,000 people cycling across Venice, really, if that had an impact over a month or 2 months, then that's long enough. If we think the new level of cycling is going to be maintained, because the second figure, the 10-year assessment period, that's assuming that the new level of cycling is maintained over those 10 years. So that's important, which is why we don't just do little short interventions. If we think something has only had a short impact, then the heat may overestimate the results because it's assuming the new level of cycling is maintained for 10 years. While I'm here on the microphone, shall I answer the electric bicycle question that two people are keen to know?
Yes.
Not yet. So electric bicycles, very, increasingly important across Europe. And of course, many studies have shown most models do require physical activity, but they require usually a reduced level of physical activity and, of course, have some sort of carbon impact in terms of the charging. So we hope to add an e-bike module to the heat in the future, and I think that it's quite near the top of the list of potential improvements to the heat.
Thank you, Nick. So many things to take into consideration.
Yeah.
I can understand. One important point, that from Venice we also coordinated the Small Countries Initiative, which is an initiative targeting the 8 countries with a population less than 1 million, and they are also participating in this webinar. So we have 2 questions from 2 of the small countries, Malta and Cyprus. Very important, I guess. What about small countries like Malta, population of approximately 400,000 and 30,000? Is this a valid tool as well? What adjustments need to be taken into consideration?
Very interesting. I can't think of any reason why it would not apply, particularly if you are looking at population level data. So, if you were, for example, assuming a population increase in physical activity across Malta, so 430,000 people walking for an additional 10 minutes a day, for example, then that's a big number. Although it may be a small population in countryside, for these types of assessments, that's a big number. So I don't think that would matter. I think it is usable.
And actually, it might even be an advantage, because we know that in small countries, when something is promoted, then the entire population can actually do that, the entire population of the country. So yeah, actually you can have big numbers there. So maybe this is another of the many advantages of the small countries.
Yeah.
You can see also another question, Nick, on air pollution.
Yes, so Jürgen's asking about basically more refined assessment of the air quality calculations. I think we may well consider additional assessments of air quality, but this was our first go, and we thought it was particularly important to demonstrate that while there may well be a reduction in health improvements due to exposure to air quality, this is tiny compared to the large improvements in health due to decreased mortality. So we started with PM 2.5 because we thought that was the most important for these assessments, but in the future we may well be able to expand that.
And I would also like to use this opportunity to remind us all that we have a next webinar on the specific tool which was developed for assessing the burden, the health burden of air pollution, which is RQ+, which will also be available in Russian by the time we run this webinar. The next webinar will be on the 5th of June, the same time, 11 a.m. Do we have any other questions from participants to Nick? In the meantime, I would also like to ask Nick whether you have any question or maybe a request to participants from the subnational level, because these are mostly our audience today. I understand also from Francesca that you are now in the phase of pilot testing maybe new features of this module, of this tool. So do you have any question or request for them?
Well, I think our main request would be keep in touch, and as you use the tool, let us know what you think, and specifically let us know, please, examples of where it's been used, and in particular examples where you think it might have made a difference to some sort of decision or policy, because we want both feedback on the technical aspects of the tool, but perhaps more importantly, feedback on how it's being used, and therefore how we could improve its usability.
Thank you. Definitely, I will also send an email to all of us, all the participants today, and also all the others who have expressed an interest in this webinar series, asking to play a little bit with this tool and see what other features might be developed in the future, or how it was used, if there are other specific examples to share, because I think it's really enlightening to see the examples that you show at the beginning. It's very inspiring also to see the possible uses that can be done with this tool. And I don't know whether Francesca has any final remarks before we close the webinar.
Yes, Francesco.
Thank you.
First of all, many thanks to all participants for your questions, interventions, and interest, and to Nick for guiding us so smoothly and clearly through the new tool. In terms of what I've been listening to and what kind of requests we have on you, I think that, of course, we have listed down, and it is very interesting to see that the list of requests, like what about morbidity, what about different economic metrics, what about electric bikes, are they coincide exactly with the list of priorities that we have compiled based on expert input. So it is very good for us to see that what we have identified as priorities for development from a technical point of view is also reflected in what the policymakers see as the priorities. I forgot to add also the heat for children, how we can capture the benefits for children. And then it comes the request, because a tool like the heat has been developed thanks to investment that have been made by different donors into the tool and through collaborative projects at the international level, for example, with the European Commission. So we are, in a way, dependent on this kind of mechanism to mobilize the resources that we need to advance the work here. Of course, there is a limitation, and the limitation is unless the science is there to move forward, even if we put there resources, we cannot move forward because we need the underlying science to be available. But on a number of these developments, for example, the electric bikes, the morbidity, some of the metrics, I'm sure that we could make some good progress while remaining loyal to the principles of heat. And for the developers, I have to say this is a big challenge, because if, for example, I go back to the question on NO2, on nitrogen, yeah, it is fine. I mean, we know that there are relative risks, those effects relationships that we could use. But don't forget that we are not developing the heat for academic institutions that have their know-how and knowledge on how to do things and can customize things to their need. We are developing this with the intention of making it usable as broadly as possible, and therefore, for example, we depend on the relative risks and the dose effects response functions that WHO uses in its estimates of the air quality burden of disease, which are based again on PM2.5. So we always have to manage a fine line between how far we advance the tool and how much we retain its simplicity and usability for the user, because let's not forget that our intention is, and what makes the heat standing out compared to many other models which are available for health impact assessment, is this thing that Nick was highlighting at the very beginning. This is probably the only tool where you can get a sensible assessment having to input only two numbers: the number of minutes that you cycle or walk, or another measure of that, and the number of people that you expect to have the benefit. And this is a very special feature that we have tried to keep more or less constant across the different developments. And it represents a challenge because, as Brancusi used to say, simplicity is a complexity resolved. So I know that we are putting very high the bar to epidemiologists, economists, and public health experts who are working with us, and the modelers who are working with us. But in a way, this is really something we really try to be very loyal to. And we welcome, therefore, your support, guidance, and partnerships if you have the opportunity of teaming up with us for the next development. We look forward to that. Thank you very much.
Thank you very much, Francesca. We have an additional input that maybe some local features of the conformation of geographical conformation of cities, like non-flat cities or cities where it's very difficult to cycle or to walk, could be factored in. That's another suggestion for you and the parents, the many people working on this tool, to take into consideration. I would like to thank once more you, Francesca, and you, Nick, for this fantastic and truly enjoyable presentation and time that we spent together. I would also like to remind you that this video will be posted on the YouTube RHN channel, and I hope that you will contribute to make it viral, to say the least. And the next meeting will be on the 5th of June. It will be on RQ+. Thanks again to the speakers, to the participants, and to Andrea Bertola also for the work, the background, the backstage of this webinar for IT support. Thank you all, and I hope to see you all at the next webinar. Ciao, have a good day. Bye-bye.